Doctor, we are ready for IVF treatment. What are your suggestions for planning this treatment at Krishna IVF clinic?
IVF treatments protocols are customized according to the couple's need and the severity of the factors. One size does not fit all. Since at Krishna IVF we get lot of poor responders and repeated IVF failures, we use a protocol called long agonistic protocol. This is done in two phases: the preparatory phase, also known as the downregulation phase, and the actual treatment phase. Suppose you consider the first day of the bleeding as day 1. You should make an appointment for a basal scan between 18th to 24th day of the cycle. During that visit, you should plan 2 days of visits to the clinic, in which after the scan is done, the couple's blood tests are done to know the health parameters, and then the male partner is asked to give a backup sample which is frozen. The backup sample is essentially giving a semen sample which is frozen, so that on the actual procedure day, for any reason the male partner is not able to give the semen sample, then this backup is done. During this phase, a downregulation injection is given called GnRH, and the documentation is completed, and the clinic will give you an appointment after 2 or 3 weeks, during which the actual next phase of treatment, called the stimulation phase, or the actual treatment happens. During the first day, the injections are started, and the dose of injection is decided by the age of the lady, the body mass index, the number of follicles the woman has, and the health issues. Based on this, the stimulation is done, and this stimulation lasts between 9 to 14 days depending on each individual situation. Once the final injection is given, that is generally given in the evening around 7 o'clock, and 35 to 37 hours later, the eggs are taken out through a procedure called egg pickup, or technically also known as oocyte retrieval. And on that day, the partner gives a semen sample, and that sample is used to fertilize the eggs either by IVF or ICSI depending on the situation. And 3 to 4 days later, the embryos are transferred, and then you're asked to come back at the end of 2 weeks to check the pregnancy test. There is another protocol called Antagonistic Protocol. This is done in certain situations, and the stimulation begins on the first day, second day, or rarely on the third day of the menstrual cycle.